I am absolutely delighted to welcome you to our first ever virtual Alumni Town Hall. Tonight we have a fabulous lineup of speakers for you. Over the course of the next hour, your fellow alumni, Dr. Knut Moe from the class of 2010, Dr. Chelsea Garcia from the class of 2015, and Dr. Javid Machikon, recently graduated from the class of 2020, will share their experiences and learnings from the COVID-19 pandemic with you. We will be asking them a few questions after each of their talks, so make sure to pop your questions in the Q&A box, as well as to fill in the registration form for that all-important CPD credit. We will also hear tonight from Anya Gibbons, Director of Development, Alumni Relations and Fellows and Members here in RCSI. She will speak to the extraordinary changes that happened within the 2020 programme of alumni activities, and will also set out plans for alumni events, communications and engagement in 2021. But first, to reflect on the year that has been and to acknowledge the contribution of alumni to RCSI, it is my great pleasure to introduce our first speaker, one of your fellow alumni, Professor Cathal Kelly, CEO of RCSI.
Thank you very much, Kiva. And firstly, I'd like to take the opportunity to welcome you all to our inaugural Alumni Town Hall. And if you'll indulge me, a special welcome to the class of 1985, my own classmates. The alumni team have informed me that our last virtual alumni event attracted over 1,500 people, including people who watched recordings later on. So I'm delighted to welcome you all this evening. This time last year, a virtual event like this would have been unheard of. And while 2020 has been a really challenging year for us all, I think it's also provided us with new opportunities and new means to connect with each other. The idea of holding this town hall came directly from you, our alumni. Over the past few months, many of you have told us how much you enjoyed hearing from your fellow alumni through the virtual gathering, as well as the weekly e-news. And this town hall is another opportunity to share our stories and reflect on the truly international nature of RCSI and indeed the friendship of the RCSI community. RCSI is really proud to have such a global alumni community. More than 21,000 alumni are living and practicing in 93 countries worldwide, representing 6 schools within RCSI. With such a large and dispersed groups, events like this are hugely important in creating a sense of connection and in sharing lived experiences across the community. I'm really hopeful that we can continue to develop and grow this type of engagement going forward. Next slide, please, slide 3. As you know, no learning institution has been left unaffected by COVID-19 this year. However, as a University of Health Sciences that prides itself on educating and developing global healthcare leaders, I think RCSI is distinctive, and we've had a distinct advantage in dealing with this because we know healthcare well. As a result, we've been aware of the impact of the pandemic on the population as well as our alumni. Many of you have played your part, and you'd continue to play your part in the front line. But beyond the front line, all our alumni have felt the effect of the pandemic in the roles you've had as clinicians, researchers, and healthcare administrators. Throughout the year, we've been inspired by the many stories from alumni which attest to your resourcefulness, your positivity and resilience, be it Kentucky to Kuala Lumpur, from Singapore to Sydney, and dare I say it, even in Donegal. These messages speak to a global community committed to their patients as well as their profession. Next slide, please. Unfortunately, we've not been left unscathed by COVID-19 as a community. At the end of March, we received the sad news that Mr. Amjad Al-Harani, class of 1993, who worked as a consultant ENT surgeon at Queen's Hospital in Burton in the UK, had passed away. He was one of the first NHS frontline workers in the UK to give his life in the fight against COVID, and sadly the first alumnus to die from it. Described by classmates as witty, helpful, and simply a wonderful person, we remembered Amjad along with all our deceased graduates and students as part of the memorial service, which was a very moving event held as part of our virtual alumni gathering in August. In a year such as this, I think it's more important than ever to take a moment to reflect, to remember and to give thanks for the friendship and guidance provided by those who've passed and played a role in our education, in our professional development, and in our wider lives. Next slide, please. And despite the unprecedented nature of 2020, alumni have continued to support and assist RCSI in many different ways over the year. Alumni have stepped forward to share your stories through interviews, news, photographs for both our e-news and our alumni magazine. Others have provided tremendous support in the organisation of events, both in person and virtually. Many more have played a role in giving in our hashtag RCSI Together for the Students' Future campaign to support scholarships, provide supplies of PPE for students, as well as contribute to the Hardship Fund. And the alumni team have been truly overwhelmed by the number of alumni who volunteered as mentors, as speakers, and as guest panelists in support of our students. Your generosity is hugely appreciated, and your support is deeply felt sincerely by students and staff alike. Next slide, please. Well, I'm conscious that tonight is first and foremost about sharing the voices of our alumni. I do want to take a minute to update you on how RCSI has adapted to ensure the best possible education and experience for our students. As the full extent of the threat of COVID became apparent in January, RCSI established a business continuity planning group to prepare for the potential impact of the virus on the workings of the university. As a result of this preemptive work, we were ready to move to online learning in March when the Irish Prime Minister, Taoiseach Leo Varadkar, announced the closure of all third-level institutions and a nationwide lockdown. This was a huge feat on the part of our IT team, our lecturers, but also on the part of our students, particularly those from medicine and physiotherapy classes of 2020, who had to move to take their exams earlier, much earlier than had been intended. And I'm sure later on tonight, Anthony Machikon will speak better to this experience than I could, having lived it. The months of April, May and June witnessed a series of incredible firsts within the university: first virtual results day, first virtual conferring. At this time, the university was also delighted to be ranked first in the world for UN Sustainable Development Goal number 3, good health and well-being, in the Times Higher Education World University Impact Rankings. Summer 2020 was no vacation for any of us. And while our students had returned home in March, our state and events team and academics moved into action to ensure that the campus could be adapted to allow for face-to-face learning while adhering to all the restrictions. This commitment to face-to-face learning saw us take the move of establishing a satellite campus in Croke Park Stadium. Many of you will remember Croke Park. It's normally witness to epic sporting events in the months of August and September, but it now became a witness to the Herculean events, or efforts of our estates and events team and faculty, who transformed the stadium into a top-class college campus, literally in a matter of weeks. In September, we were delighted to welcome back new and returning students, working groups comprised of faculty, staff, and particularly of importance, student representatives, put huge work into ensuring that orientation and induction could be delivered in a safe yet meaningful fashion. Particular acknowledgement is due to our first-year students, many of whom have never been away from home before, who took the courageous step of coming to Dublin to become a healthcare professional and start their pathway on a career in healthcare. Our student services and our Compass counselling and support team have provided incredible support to these young people. Likewise, the health support and COVID-19 testing provided by our wonderful team at Mercer Medical Clinic has been outstanding, and I'm delighted to report that all our students remain safe and well. We essentially set up our own health service, doing our own testing, our own contact tracing, our own healthcare management, working in parallel with the national system, but moving much more quickly and effective and tailored for RCSI. Finally, this Christmas, over 1,700 of our students have chosen to stay in Dublin for the holiday season to minimise travel. No doubt this has been a really difficult decision for students who must be missing family and friends. I think it shows their maturity and resilience that speaks so well of their future as healthcare professionals. And I personally couldn't be more proud of them. Our staff have been as busy as Santa's elves preparing a programme of activities to keep our students entertained through the week. And I would like to thank you all who contributed to a Christmas stocking, in truth, more a Christmas sack, there's so much in it, for students as part of a festive night in initiative. While it's just a small token, I know it's hugely appreciated by the students who must remain away from home for Christmas. This in a series of student and RCSI-led events, including Christmas dinners, both vegetarian and halal on Christmas Day, learning community dinners after their last classes, will hopefully give them a meaningful and memorable Christmas. Once again, thank you all for taking the time to join us tonight. It's been a real pleasure to speak to you, and I am delighted to hand back to Kiva from our wonderful alumni team to introduce our first alumni guest speaker, all the way from Trinidad, Dr. Chelsea Garcia. Thank you very much, Kiva.
Thank you, Cathal. And now I am delighted to introduce Dr. Chelsea Garcia, graduate of RCSI School of Medicine 2015, who was working at the University of Miami at the outbreak of the pandemic. Over to you, Chelsea, to tell your story.
Thank you for that introduction. It's an honor to be presenting today. The sound of the Irish accent brings back many happy memories of my time in Dublin. Since graduation, I went on to become an American board certified internal medicine physician at the Cleveland Clinic, Florida, and a palliative medicine and hospice specialist at the University of Miami and Jackson Memorial Hospital. Next slide. For those who don't know, internal medicine is a medical specialty dealing with the prevention, diagnosis, and treatment of internal diseases. Palliative medicine is a medical specialty that deals with an individualized medical approach to persons with a serious illness. The goal is to improve quality of life for the patient and their family. It incorporates physical, mental, social, and spiritual aspects to treat the whole patient. It's appropriate at any age or stage of a serious illness. It really is such a beautiful medical field, and it's where I've found my calling and my passion. Next slide. As some of you may know, next slide. As some of you may know, I have great timing with my pregnancies. My first being born in between RCSI final year exams. Well, as luck would have it, at the onset of the pandemic, I was actually heavily pregnant and covering the palliative medicine inpatient service in Miami. I really was very fortunate as I worked for an institution that made accommodations to keep me practicing safely. I never dreamt I would face the experiences I faced, having to walk families through the death of their loved ones from a cell phone, telling families they can't see their loved ones who are dying, and guiding families through the process of ventilator withdrawal, when medicine could do all it could and no more. With families not being allowed to visit, patients were left on their own in the hospital, which without COVID is already a traumatic experience. And now they are without their support systems and their major advocates, their families desperate to hear medical updates. I don't know what we would have done without technology. In record time, providers were utilizing telemedicine. Patients' phones in their rooms served as a lifeline, not only for patients' use, but for the doctors as well. In-person visits were minimized as much as possible. And now more than ever, doctor-nurse communication was crucial. Amongst the fear, anxiety, chaos, I was proud to see the strength, kindness, and support from my fellow healthcare colleagues. We banded together, regardless of medical specialty, hierarchy, or job description, to support each other and make the best of a difficult situation. The Center to Advance Palliative Care saying goodbye to a family member over the phone script was developed to help providers with these difficult conversations. And it's something that I used as a tool a lot. It gives specific phrases and responses to help family members share their last words over the phone. Here's an example of one of those conversations I would have with family members multiple times a day. We have the opportunity to make this truly special, and I'm here to walk you through it. Here are 5 things that you might want to say and pick which rings true for you. Please forgive me. I forgive you. Thank you. I love you. Goodbye. You can start whenever you're ready, and the phone is right next to the air. My experience was life-changing, and although incredibly challenging, I set out with a goal to make each patient and their family's experience as peaceful as possible, given the circumstances. Next slide. I want to highlight the impact COVID has had, not only on COVID patients and families, but on those without COVID. The cancer patient that endures a 30-day hospitalization with no one by their side, or that had their treatments postponed due to COVID and now their cancer has advanced. I saw so much suffering in this vulnerable population. 7 months after the pandemic, next slide, I moved home to Trinidad, a planned move after the birth of my son. My home-based healthcare company, Live Health, set to launch in January, offers internal medicine, palliative medicine, and hospice services at home. My aim is to bring the hospital home and keep my patients from entering the hospital. I actually do not currently see COVID patients, as my patient population is vulnerable and my protection and their protection is my #1 priority. I have essentially moved from the front line to the back line. But I believe this is essential to protect vulnerable patients and to free up the hospital service to handle the surge in COVID cases. Next slide. I want to end with this. We will all face challenges in life. It's our response to these challenges that make all the difference. We still have a huge uncertainty going forward in regards to coronavirus. Let us, as healthcare providers, face it head on with a positive mindset and, most importantly, together. Thank you for inviting me here. I'm sending all the Caribbean warmth to the Emerald Isle. It was a pleasure, and I'm open to any questions that anyone might have.
Thank you so much, Chelsea. That was really, really interesting to hear your role there over the last number of months. I have a couple of questions for you, but I might just, first question, ask you to maybe turn your camera on just so we can see you while the Q&A goes ahead. If that's okay.
Oh, you weren't seeing me this whole time.
No, it didn't detract from the presentation. Super, that's brilliant. So I suppose it's really interesting to hear of your work there, but in reflecting on 2020, are there 1 or 2 ways that the COVID-19 pandemic has changed your outlook towards your work specifically?
Well, first of all, I think that we're accustomed to guidelines, protocols, this is what you do, you follow this line. But here was a pandemic that was just thrown upon us. I mean, I, for one, didn't expect what was coming at me. And it just showed us how quickly in a moment something could change. And you have to be present, you have to react. And that's essentially what we all did. And we tried to make the best of the circumstances. But what I saw was, we had to deviate from the norm. We had to deviate from everything that we were accustomed to and really try to just essentially go with the flow. And I think in medicine, it really helped me to identify that, we need to find the flow of each patient and really take what's happening in that moment to go forward. And sometimes, we do have to throw those guidelines out of the window. And as a doctor or as a healthcare provider, be there with our patients and their family in that moment.
That's great, Chelsea. Thank you so much. And I suppose, obviously, COVID-19 has led to these amazing developments in terms of the saying goodbye to a family member over the phone. which is quite a positive development in your field of work. But do you see maybe these developments continuing in practice beyond the pandemic? Is there opportunity to learn from these and strengthen them even further going forward?
Oh, there's a huge opportunity. I mean, COVID has had, of course, we all know the negative impact, but I also believe that it has had significant positive impact in the healthcare system. I mean, telehealth was always something that I wanted to explore, but within days, I would say even hours, telehealth exploded. And to me, I mean, just learning how to operate telehealth, we're all forced into it, which is a good thing because sometimes we need a little extra push to change the norm and what we're accustomed to. But it was a huge positive impact for us. And I think going forward, even without COVID and as things start to settle, we have a lot more input from technology to our patients, and it allows us much more connectivity to them. Other things that I found impactful is even a patient's phone or camera in the room. Now we can utilize that. Before, it was regular rounds. We really try to look at all different avenues and really be flexible. And I think as providers, we're learning that going forward, there's a different way to the way we're practicing. And I think forever it will be changed, hopefully for the positive.
Great. Thanks very much, Dr. Garcia. And I suppose to finish up with my final question for you, which I'm also going to ask to Dr. Moe and Dr. Machikon, I suppose, we're not out of the woods yet, although there's definitely hope at the end of the tunnel, light at the end of the tunnel with the vaccine. But what are you most looking forward to after the COVID-19 pandemic passes, either professionally or personally?
Oh, well, I think I'd say to travel again. I'm accustomed to I travel a lot, and I'm ready to escape Trinidad's borders.
Excellent. Well, thank you so much for answering those questions, Chelsea, as well as for your talk. It was really incredibly interesting. So now I'm going to introduce our next speaker. Our next speaker is Dr. Knut Moe from the class of 2010. A vocationally trained GP and associate clinical professor in UCD's School of Medicine, Knut's interests include men's health, occupational health, and all aspects of general practice, especially general practice management and development. Interestingly, he is also an approved seafarer's doctor of the Norwegian Maritime Authority and conducts seafarer examinations for multiple cruise ship operators. So now I'm going to hand over to Dr. Moe. I just ask that you have your video and your mic on, and we look forward to hearing your presentation tonight.
Thank you, Quiva. I probably should have let you get the bio from my website. I'm not sure I probably would have put all of that in, but listen, I'm grateful to be here. Thank you very much for having me here to speak. My name is Knut Moe. I am a GP and I'm a graduate from RCSI in the class of 2010. We were due to have our 10-year gathering this year, so we had to enjoy it virtually instead, but we're very much looking forward to a bumper 11-year gathering next year, along with the year that followed us. So looking forward to that next year. Next slide, please. So just a brief background, I graduated, as I said, class of 2010 and completed my GP training through RCSI, and subsequently went on to work in two family-run general practice clinics, which I manage. One with my father, who I think is online here, class of 1971, a Norwegian who came over and met an Irish woman, and then also my wife Hannah, who's class of 2007. So we're very much RCSI kin. I am also an associate clinical professor in an inferior college south of the RCSI, and have a few other interests. I'm medical director of a pharma startup, and definitely have an interest in practice organisation, healthcare organisation. I've done an MBA as well. Next slide, please. So don't go back. That's it. So in February, I was looking through the pictures just to throw up a flavour of what's been going on, and This came up in February the 8th. It was a whole way of life ago. This was me in the Aviva Stadium watching Ireland-Wales in the Six Nations. And then the next day I went on a family holiday to Tenerife. So Chelsea, I'll happily swap at any stage. You know, if you want to come visit Dublin again, we'll happily do a swap if we can. But then we came back, and the next slide, please. And it was all change. Word was coming of COVID, and we basically had a very short period of time to rearrange how we operated. The biggest challenge at first, like so many worldwide, and this is in general practice specifically as opposed to large hospital settings, they had their own particular cases. Remember, 95% of healthcare interactions on a daily basis in Ireland happen in general practice and not in the hospitals. So we have a very particular set of challenges. PPE procurement was very, very difficult. We ended up buying hedge trimming masks, which worked very well, as the goggles that were provided were fogging up on every occasion. We had to change practice policies. We couldn't have walk-ins anymore. We had to install buzzers in the door, reconfigure, take out half the waiting room seats. Same as everything has gone on, but also the important thing is we operate on a very thin level in terms of staff. So we had to have contingencies together. You know, I work with my wife. What happens if I get sick, and we have to self-isolate? Does the whole practice have to shut down? There was all of these things that we'd never even considered. To take an example, the PPE on the bottom right there expired in 2017, and that was the only PPE we had in the practice for any sort of a pandemic preparation. And I think that was with Ebola for an outbreak in the past. We adapted quickly. General practice has been traditionally very good at adapting. We had networks with other practices. We had to form policies on how we deal with nursing homes. We look after nearly 200 nursing home patients across 5 nursing homes in one of my practices, and tough decisions had to be made about end-of-life care, resource planning, hospital to transfer planning. Many of the conditions I'm sure Chelsea had to deal with. We had to plan for those early on, all the while building the plane while flying it, in terms of trying to figure out what COVID is, how to reassure our patients, with changing referral pathways, testing capacity, and case definitions and algorithms. Next slide, please. So the new normal basically became, if you were a patient of our practice, you wouldn't see me with the silly head of me with my headset on, or you would see me early on wearing a full-on PPE outfit. And the way we interact with patients has fundamentally changed, and there's some positives in that, but there's also some challenges in that. And the biggest initial challenge, and maybe when the first wave ended, was getting patient buy-in, patients to understand the reasoning and change their habits. And so with that came safety, but came challenges also. So if we think about telemedicine, while it became adopted very rapidly, where I think GPs traditionally have been quite hesitant, it became very useful to have, but it does have pitfalls. We can't rely on subtle cues. The quick, are you okay at the end of a consult, that, you know, if we see a patient that we know well, who might be struggling. Physical examination is quite limited. I had a lady who said she had a little blister on her finger, and I said, let's have a teleconsult, and her finger was 4 times the size it should have been, and she nearly lost it and spent 10 days in hospital. So we have to adapt the way we ask questions and manage risk. So there are those near misses. So I think it works best with established patients. New patients to the practice, perhaps it's a little bit more challenging. It's also really, really time consuming and exhausting. So I think we found at the end of the day, our clinic boundaries weren't really as set, and you'd find yourself just working through a call list, which was never ending. And then obviously the in-person consults, you had to figure out PPE, what level of PPE for what level of risk. Next slide, please. So a few things, I just want to talk for a couple of minutes, a couple of initiatives that I was involved in setting up, and really screening form is the first thing. It's just an example of how we can innovate and adapt in general practice. On the 14th of March, I was working in an out of hours setting, and there was 220 patients waiting to be triaged. and all for COVID queries. And I had a premonition that on Monday morning, my poor secretary would probably walk out the door if anything close to that was happening. So we set up a new way for them to interact, which is effectively to fill out a symptomatic screening form on our website. So the patient generated the data that we had to capture in order to be able to refer. It also helped us to triage mild, moderate, or severe cases, and it reduced our GP consult time by about 50%, but also our telephone admin time with receptionists. So it really streamlined the process, and this is something that really went further than I ever imagined it would. We opened it up to any practice who wanted to sign up for free. So we've got over 350 practices in the country signed up, and at last count, I think about 50,000 patients had submitted forms. So it's really useful, and it's really simple. An email comes into the practice, you just copy and paste it into the health record, and then send the referral away once you've spoken to the patient. So so that's just one thing that I've been involved with, and I was involved with that with a group called GP Buddy, who helped me scale it up. And if you move on to the next slide, what we noticed is in general practice, early on when the testing capacity wasn't there, there were strict referral criteria. The capacity was limited. Case definitions didn't include high risk patients, didn't include certain symptoms. And what we discovered was, well, we were maybe referring 5 cases in a day, but actually there was 5 more cases that weren't being picked up. So we felt there was a lot of symptomatic cases that weren't being referred. So what happened was we asked GPs to fill out a brief questionnaire at the end of their working day about the number of cases that they were referring daily, and we can see over a period of time that the difference, the pink line is the number of cases seen, and the blue line was the number of cases referred. And as the case definitions were changing, and as the country started to open up a little bit, those numbers joined together. Can we go on to the next slide? And so what happened, the numbers fell to quite a low level during our summertime, and like everybody, well, like a lot of people, we got to enjoy a good summer. The big spike you'll see in the right of that graph in front of you is the Monday after the schools reopened, when we had a 5-fold increase in patients being referred or contacting their GP for COVID testing. And what you see in the right-hand side there is our geographic heat map. So what we also did was we divided those patients out by regions. So it enabled us to see areas that potential hotspots that might be developing over time. So this was an early warning system for the second wave. And if you go on to the next slide there, please. So the advantage of this, and this is accurate as of the day before yesterday. I think this is the latest one that we have. The yellow line there is the calls we're now having about COVID. The blue line is the ones that we're actually referring, and the pink line at the bottom is the number that we actually think are COVID, rather than the patients who are, mild cough, cold, or maybe a runny nose. So it's giving a little bit of a GP's clinical suspicion. And these numbers effectively are giving the HSE, the Department of Health here, and the National Public Health Emergency team on a daily basis. These numbers are being fed in, and it's giving them an idea of increased activity 48 hours before the actual case results are reported. So it's helped them as regarding relaxing restrictions and testing centres and hubs and that. And it's just shown the importance of GP level research in this, and the clinical suspicion, the key part that GPs have had to play. And we just move on to the next slide, please. So just to finish, really, how has Ireland done? I was trying to figure out a way of putting this together, and there's the good, the bad, and the ugly, really, when it comes to our response. And I think the general consensus is that we've done very well. We've locked down early, and we've locked down quite hard, but it seems like it's been timed quite well. And while we see countries like Germany and Holland going into hard lockdowns again over Christmas, we seem to be, hopefully, from listening to Micheál Martin, our Taoiseach today, it seems like we may have some more restrictions towards the end of the year, but that Christmas should be okay. Our hospital system was never overwhelmed, so we never had the scenes like you see in New York or Italy, which was the key thing that we wanted to avoid. As Chelsea alluded to, the willingness to adapt under pressure, to embrace new technologies and practices, has really catapulted some innovations that have been stagnating for a while into action, and hopefully that's a really long-lasting change, and hopefully that there's momentum there for those changes to further us in terms of our healthcare system. Things like e-prescriptions, which we'd been lagging on in a big way, telemedicine, online clinic bookings, all of those things have really come on leaps and bounds. In terms of general practice education, we frequently have 1,500 GPs on a webinar every single Wednesday. So we've had at least 25 webinars with various different speakers, updating us, and the appetite for learning and the appetite for contributing to these has been massive. And there's also been cooperation, one of which is a really good example is RCSI Connect, which was a link between GPs and specialists to try and get advice without necessarily having to refer a patient into hospital, where they might be at increased risk, which is a really beneficial service to GPs that they had a port of call. And I think there was evidence of leadership amongst clinicians in some of these initiatives throughout Ireland, and doctors and healthcare providers really stepped up to the plate. So as I said, Christmas not cancelled yet, and we're hopeful about the vaccine, maybe a few given before the end of the year. As it was the bad is the impact on the non-COVID waiting lists, which have increased. It's estimated that there was a 70% reduction in cancer diagnosis. These are statistics from, I think, Northern Ireland and Wales, but I would imagine that they're very similar in Ireland over the initial lockdown, and the impact of that is only going to be felt in the months and years to come, unfortunately. So there was also the private hospitals were taken over, and I think a lot of the private work was put on the wayside. So that was a challenging time. Definitely challenging as a small business. General practice, we're not employed by the state. We have, we run quite lean operations, and thankfully we did have supports from the state, which was very helpful. Really part of our job, we love seeing patients, and there was an awful lot less face time with patients, and so sometimes you feel like a call center operator, and that's not the way we were trained to operate or to do medicine. So that's been really challenging, and yeah, I think everybody could do with a holiday at some stage. The real fallout, or the ugly, is I suppose the nursing homes and care homes. They've really struggled, and we're hoping to get vaccines into them as soon as possible, and because the challenge there, not being able to see relatives, the death toll has been way too high. And I think what we're seeing now is the mental health fallout, and is a huge collateral damage from COVID as well as the other undiagnosed illnesses that we're only beginning to find out about. Next slide, please. So that's it. That's our little elf on the shelf in our practice, keeping all our kids well behaved. Thank you very much for having me. I'll take any questions at any stage. Sorry if I ran on a little bit.
No, thank you so much there, Dr. Moe. Really great presentation, and some great insights, particularly for our alumni who are joining us internationally. I was really interested on the slide around the new normal and the idea of changing habits. Do you think that the current sort of public health guidance that has been ramped up around washing our hands and being more mindful of spreading germs, do you think that's here to stay? Will it have a long-lasting impact on society beyond COVID-19?
Well, I certainly hope so. I think that the lack of a flu outbreak yet this year, and certainly the lack of a flu outbreak or a spike in Australia, would show that there's additional benefits of having these hygiene measures that really we should all be doing. And I know some cultures would be much more commonplace at having those, such as Far East Asia would have a culture of that. It was bizarre on the 6th of February. I was on a plane and I saw two people wearing masks, and commented to a friend of mine, this, that's a bit unusual. If I walked in somewhere without wearing a mask now, I'd feel like I'd feel very uncomfortable. And so I think our perception or our attitudes of these things have changed. I think there's enough buy-in now that hopefully we'll definitely be wearing these masks for as long as we need to, and operating distances. But I think people like hugs as well. So there's some sort of middle ground to be struck. I think over the coming years, hopefully months, but probably years. Right.
And I suppose, you outlined there the good, the bad, the ugly. as a result of COVID-19, what do you feel is probably the most important systemic learning for general practice within Ireland?
Well, I think the power of general practice as a group to work together, I think systemically, I think our importance to the healthcare system in Ireland has been, I think we probably felt that we haven't, as GPs, that we haven't been considered all that important, but I think we probably feel more valued, and valued is probably the better word than important, in terms of how we've operated in keeping people out of hospital. And I think we are, GPs adapt. GPs have always adapted. We all have electronic health records. There's a lot that I think the healthcare system can learn from general practice, the way it operates. And we just have to be able to continue to adapt and work with each other. I think we probably operate in silos quite independently of each other. And so the fact that we would form a network with our neighbourhood GPs and learn from each other and help each other out with PPE, that sort of collegiality is important to maintain, because we're not in hospital settings, we are in small community centres, and sometimes that can be quite isolating. So being part of that network is very important. That's something that would be important to maintain.
Yeah, very interesting. And I suppose the final question, as I asked Dr. Garcia, what are you most looking forward to when COVID-19 passes? And as I said, this can be either professional or personal.
A pint in a pub. Our pubs, which I haven't mentioned, have been closed since March. And our wet pubs that don't serve food, for anybody who hasn't been in Ireland. So Ronan and the Swan has not been open since March. And so obviously to support the pubs, but yeah, just a point, getting back to some sort of level of normality. I don't think I'd want to go just yet. Also, I have a nephew born in London in April that I haven't met yet. So I think it would be quite nice to meet him at some stage. They're my personal goals. And I think, what, professionally is really the appetite for change, for innovation. I think there's genuine momentum there. And I think institutional inertia is quite inherent sometimes in old healthcare systems, particularly like the HSE. And I think like times of crisis, they really showed themselves to be able to adapt when the will is there. So that momentum is important to keep up, I think.
Great. Thank you so much, Knut, for your time this evening. I suppose our final alumni speaker, although not our final speaker of the night, is Dr. Javid Machikon, a recent graduate of the class of 2020. So Javed was actually SU president in his final year, so last year in RCSI, and is now an intern doctor and intern representative at Connolly Hospital in Blanchardstown. So Javed, I might just ask you to turn your mic and your camera on, and I'll hand over to you.
Hello, good evening, everyone. As they said, my name is Javed, and I'm a recent graduate of the class of class of 2020. First of all, I must say it's a very massive honor just to have the opportunity to address so many of you who are far more qualified than myself. It's very comforting to just look at the caliber of the RCSI alumni, and just to see how far and accomplished that many of you have come. It is that reason, though, that I was very much apprehensive about doing this talk at the beginning. I felt a bit intimidated and very much out of my depth, thinking, what could I, an 8-month-old doctor, offer to people who have years, and some of you, decades of clinical experience? But it is that unnerving and intimidation that I think convinced me to do the talk in the end, because that feeling has been with myself and with a lot of my classmates from 2020 for the entire year. And it's truly a great opportunity to be able to share my experience and my journey through that. So next slide, please. This is my career pathway in 3 stages over 2020, and I think it applies a lot to the rest of my class as well. The first photo on the top left of me with the stethoscope was actually last day as a student in medicine. It was the day of my long case. I think that was a picture that came about 3 months too early. As Prof. Kelly said, our exams were brought forward by about 3 months. And I can still remember being in the library when the head of medicine made that announcement. Once I heard it, I think I went through the 5 stages of grief in about 5 minutes. But as soon as that was finished, we hit the books and we started studying very, very hard. I'm very happy to say that myself and the vast majority of my class passed, and we did quite well. But after the turmoil of the exams, something a bit more difficult came along, in my opinion. And that brings me to the second picture, the bottom left corner. That is what we call graduation day 2020 in RCSI. So that was the day that everybody was very much looking forward to for very many years. But instead of sitting down in a big, great hall and hearing our names being called out with doctor in front of it for the first time ever, we were sitting down in the living room in pajamas and fuzzy slippers. A day that everybody was looking forward to for so many years was cut down to about 2 hours on a 13-inch MacBook screen. And in that time, I think we learned something very special about RCSI. One of the best things about RCSI is that you make friends from all over the world. And one of the worst things about RCSI is that you make friends from all over the world. Right after graduation, some of my best friends had to go back home to their home countries. A very bitter goodbye that I'm sure everybody on this call knows about. But after all of that, it wasn't all rocky waters. There were some good things to come. And that brings me to the third and final photo of me dressed up in my gear. I sent that photo to my mother and she was very, very worried. Due to the pandemic, all of my classmates and I were able to start our internships here in Ireland. And at this point, I must say thanks very much to RCSI and to my class, because I felt so much more pride when I actually walked into Connolly Hospital on that first day of internship than I ever would if I were to walk across any graduation stage. Now, with all that being said, the thrill of being a doctor wears off extremely quickly, way quicker than I thought. I think it's the second time I put in a urinary catheter that I realized. But the feeling of knowing that, you know, our class could join in the healthcare fight and offer some sort of help, however little it might have been, to our colleagues who were feeling very much overwhelmed and in a system that, in my opinion, was under a lot of stress. I don't think that feeling will ever fade for as long as I live. And I think with that being said, it is worth mentioning a little bit about my experience in the pandemic. And that brings us to the next slide. And this can kind of be split into two different things, I think. As a medical student, before the pandemic, things were pretty much standard, as I'm sure you all could appreciate. But as a student, in my opinion, you always have that feeling of looking in through a window. You never really establish that real relationship with the patient. You don't, at the end of the day, you don't prescribe the medications, and they don't really look to you in so much confidence as they would as their primary physician. And that's why when I actually became a doctor and I started working at essentially the height of the pandemic, it was extremely oddly normal. It was almost like we were born into it. We started working when it was normal not to see family members on the ward rounds. It was normal not to have to shake a patient's hand. And it was very normal to have to change into about 50 different layers of PPE when going from one patient to the next on a ward round. Some of my senior doctors used to tell me stories about the wards before COVID, to the point where it would sound like fairy tales and ancient history, instead of being just 9 months ago when I experienced it as a medical student. So oddly enough, to me at least, the way things are right now feels very, very strangely natural. And as I think about the future, after the vaccines and when hopefully things go back to as they were, I wonder if it'll be more of an impact to me and other junior doctors. Would it be more jarring, or would it be like opening our eyes after we were kept in the dark for a very long time? A lot of it to me is still very uncertain, but I do think that there were a few certain things and certain positive things to come out from COVID. And that will bring us to the next slide. And the first one would be healthcare funding. It's a clear fact that far more money has been invested into the healthcare sector right now, into the HSC specifically, and even the doctors themselves. It seems that in my hospital, the increase in the current workforce has helped to alleviate and somewhat distribute the workload, and therefore I think improve the quality of life of the doctors, and therefore increase the patient care and standard. The next positive, in my opinion, is that there has been far more of a spotlight on the importance of maintaining your health to the general public. Now, whether or not people will continue to look after themselves and focus on that, on their own health in the long term, I don't know, but I certainly hope that it does, and in the end will help to alleviate the burden of the burden on patients and on the healthcare system right now. And finally, I do believe that there are far more opportunities in Ireland specifically for the junior doctors. For example, as I said, we were all offered an internship post. For the non-EU doctors, this would not have been possible in a pre-COVID world. So whatever your thoughts on COVID, the effects can be felt far and wide. And to me personally, from an emotional standpoint, I think it could go a bit like this. Next slide, please. So for me personally, it has been about a year since I've seen my family, and I thought that this wasn't affecting me at all. But I think, like many other doctors, we have a tendency to push our emotions to the side, to be able to ensure that we are efficient machines and that we are good at our jobs, to make sure that we are able to take good care of our patients. But at the end of the day, I think we forget to take care of ourselves. And this year, for the first time in my life, how true that was. A lot of times during the year, I felt very much alone on my own, and all I wanted to do was jump on a plane and head straight back to Trinidad. And I think a lot of junior doctors felt that way as well. I'm very lucky this year to be the intern rep for my hospital, and it is with a very heavy heart that I have to hear some of these stories about my junior doctor colleagues, about how sometimes they feel overwhelmed, sometimes they have to take a break just because they have a breakdown, and sometimes it just feels too much. But in some warped and twisted way, I think that these problems have helped to unify us as doctors across the country. And that brings me to looking at Ireland as a country. Although I do believe that there is some distance to go, I was very happy to see that there was a huge amount of solidarity and camaraderie shown amongst all the doctors and from the public to the healthcare workers. I do think that this has helped to open up more discussion about doctor well-being and mental health. And in my opinion, it is certainly a step in the right direction and something that needs to continue forward in the years to come. And with that being said, I think it brings me to my final point, which is the next slide, please. And that's my take-home message. That picture there is of my entire class for our conference ceremony. My take-home message is to support our colleagues. The simplest acts of kindness tend to make a world of difference, especially to junior doctors. I can say that from a lot of experience. I can't express how much it meant to me to actually hear my consultant say, "Well done today, Javed," or to actually have my registrar sit down with me and talk to me just for 5 minutes after I had lost my first patient. With that being said, I would just like to say thanks very much to all of the RCSI alumni, all of you, and all of the doctors and healthcare workers across the country and across the world who have been involved in this pandemic and who have given their lives. Thank you very much, and it is truly an honor to finally be able to proudly call myself part of the RCSI alumni. Next slide, please. I humbly dedicate this talk to the class of 2020, and wherever you might be in the world, I wish you the best.
Thank you so much, Javed. Such an inspiring presentation there. Really uplifting at the end, and we are honoured to have you as part of the alumni community for sure. I think what you were talking about towards the end there in terms of the health and well-being of doctors and junior doctors specifically is really interesting. Obviously, you held the role of SU president and you're now an intern representative. I'd be interested to know, other than the acts of kindness and supporting your colleagues, could there be more done in terms of support networks for junior doctors and some ideas you might have in that regard if you do think so?
I do believe so. I think right now there's a lot of, one disparity between the junior doctors across Ireland. It's a very fractured system. I think a little bit more could be done to help unify the country. the junior doctors across the country, typically things like a mentor support system. And I know that the current NCHD lead is working on something like this, but right now it feels kind of difficult as a junior doctor to find the right support in certain things that I might be interested in. For example, I'm very much interested in surgery, but it's very difficult to find somebody who, you know, is kind of willing to take you under their wing and help you out, support you along a career. And these types of things, especially career ambition for junior doctors, is extremely stressful in Ireland, and is one of the things that adds to the most amount of stress in the workplace. So having systems like that would kind of help doctors to have a little bit more security in their careers, in their jobs, and in their direction. And in so doing, it will definitely help their quality of lives.
Yeah, great idea. In terms then, I suppose, you know, the class of 2020, extremely unique circumstances. The class of 2021 have seen the writing on the wall for a good year in advance, but for that class of 2021, they're still graduating in very difficult circumstances and an uncertain landscape. And, you know, having graduated just recently, what would your advice be to them?
To the class of 2021, I guess they have had some sort of experience, I guess, seeing us before. And I do think that the class of 2021 has it much, much harder, because at least for my year, we were able to, you know, kind of get the brunt of our final year. You know, we still had the opportunity to enjoy it and to have a great time in it. It's just towards the end that we lost everything, but they lost their entire final year. So they have been, you know, they have been experiencing it very, very difficultly. I do think the best thing they could do is, you know, adapt as much as they can, roll with the punches. And I think RCSI did actually come up with some great ideas in terms of how they could support them virtually, and some of the ventures that they had, like such as the Christmas and stuff. It's going to be tough. It's going to be very difficult to say goodbye to your friends that you've been seeing for 5 years. But just know that the things that you're doing here is a sacrifice that everybody appreciates. And hopefully in the future, you will be able to reconnect with your classmates and celebrate and know that you were part of something that was very, very much bigger than, you know, yourselves.
Yeah, I think that's a great message. And I suppose the same question that I asked Dr. Garcia and Dr. Moe for you now, Dr. Machikon, once this all passes, what are you most looking forward to, either personally or professionally?
I am going to jump on a plane and go straight back to Trinidad. That's my personal looking forward to, I guess. I miss my family a lot, so it will be very nice to see them again. From a professional standpoint, I think I'm very much excited to see the direction that the Irish healthcare system goes in, specifically for junior healthcare doctors. Obviously, there's been a lot of positives that come out of COVID, like, you know, the opportunities for the non-EU NCHDs especially. But I would like to see them, you know, maintain that direction of, you know, providing certain opportunities for NCHDs, specifically in terms of like training programs and, again, more support for the doctors, particularly in terms of career and mental health. So that's something that I would really, really like to see going forward.
Great. Sounds like you're volunteering to get involved in something there, Javed. So I'm sure that they'd be delighted to have you on board. So thank you so much for your presentation. And my thanks again to Chelsea and Knut. It has been really incredible to hear your experiences, to hear the challenges that you faced and how you responded so positively and innovatively. We also know how very busy you are, so we really, really appreciate you giving the time to us to share your stories with us and with the wider alumni community. So now I'm pleased to introduce our final speaker, Miss Anya Gibbons, who's the Director of Development. She will take a look back on alumni activities in 2020 and also share some of our exciting plans for 2021. So I'll hand over to you now, Anya. Thank you.
Thank you, Quiva. Hello, everybody. I would like to echo Quiva's sentiments and to add my thanks to our wonderful alumni speakers this evening. Never in our lifetime has there been a more challenging time in healthcare. To hear you share how you persevered in the midst of this pandemic is truly inspiring. and we really appreciate you taking the time to share your experiences with us. We are incredibly grateful to our alumni across the world who have united to support the delivery of a programme of alumni activities, which had to be completely reimagined as a result of COVID-19. 2020 started brightly with an entertaining talk about the Hospitals Cup as part of the In Conversation with Alumni speaker series. Then in early March, we gathered for a hugely enjoyable evening in the House of Lords in London, where Lord Aradarsi hosted a wonderful reception attended by 300 alumni. It was to be our last hurrah. And recalling now my conversations with many of you from that evening, while we had a lot of fun, and we had a lot of fun, there was a sense of anxious tension in the air that evening too. But change is the law of life. And as we reflect on this unprecedented year, it is really great to be able to say that as we adapted our programme of receptions, talks and reunions, you all came with us on that journey too. Next slide, please, Laura. We were able to deliver the gathering, our annual reunion for all the anniversary classes virtually in late August. Over 1,600 alumni tuned in to watch the series of alumni talks, the virtual tour of the Simulation Centre, which is always a crowd pleaser, as well as to listen to a poignant memorial service, which Cathal alluded to earlier. Recognising your appetite to stay connected, we celebrated our Alumni Awardees, both in print and on video. 6 inspirational awardees: Aisling Brennan, class of 2002, Carol Hilliard, class of 2004, Dr. Sanjay Chottermal, class of 2005, Deirdre Healy, class of 2006, Dr. Amr Sharif, class of 2007, and the Queen Bee, Professor Mary Leader, class of 1976, all featured in the last 6 editions of e-News, and I hope you enjoyed reading their amazing achievements. On foot of your feedback, e-News has been completely reimagined. It is published once a week due to popular demand, and your voices are to the fore at all times. We hope that you enjoy the stories shared by fellow alumni through the interviews and photographs we publish. There is no fear that we're going to run out of content anytime soon, but please do continue to share your experiences, as well as those of your classmates, with us. Now, we thought about how to capture and chronicle this year, so we issued a special edition of the 2020 Alumni magazine. It is dedicated to our alumni and how you responded to the early days coping with COVID-19 in your hospitals, in your practices, and in your clinics. The commitment of alumni working on the front line was captured in the very candid selfies and snapshots that featured on the front cover, and they continue to inspire us and to make us very proud of you. Next slide, please, Laura. We cannot thank you enough for the solidarity you have shown to our students. The Student Services team has been overwhelmed by how supportive alumni have been, particularly at a time when there are already so many demands on your time and energy. Over 100 of you shared messages of welcome with our new students in September, and a huge number of you registered as online mentors in October. While more recently, we have seen your generosity in donating to the Festive Christmas Stocking Initiative for those international students who must remain in Dublin this holiday season. Your actions speak to the strength of connection and sense of kinship, and Knut mentioned that sense of kinship, and it's shared by all of you who are proud to call RCSI your alma mater. Next slide, please, Laura. So looking to the future, Well, I am excited to announce a series of new virtual events, which will take place early next year. So planning for the popular events, such as In Conversation With and the Alumni Awards, is already well underway. And we hope that by going online, we will be able to make it easier for you to attend these events, no matter where you are in the world. The schools of physiotherapy and pharmacy are organising virtual receptions in January and February. And furthermore, at the bequest of alumni, we are planning to launch a speaker series organised by alumni for alumni in both North America and the Gulf region. And we're also excited, Javed, you will be pleased to hear. We're excited to be liaising with the Students' Union and with clubs and SOCs. And we're creating a series of talks by alumni for current students. And if you would like to be involved in this initiative, then please do get in touch. Responding to your feedback, you asked us to share more information about the students and scholarships supported by both individuals and classes, and to include more detail about the student programs that are funded by alumni. And we are really happy to do that. Thank you sincerely for all your support. Our campaign this year, RCSI Together for Our Students' Future, funded a PPE welcome pack for all returning students in September. It funded scholarships for 5 students from Africa who come from financially challenged backgrounds and who we understood were really struggling. And you helped us to add emergency funds to the Student Hardship Fund, which is often a lifeline to students who unexpectedly find themselves facing financial hardship. Thank you to all of you for your kindness. Next slide, please, Laura. I would like to conclude this evening by thanking you for your friendship and the support that you have shown to RCSI, to our students and to our staff. We couldn't be more touched. We couldn't be more grateful. And we look forward very much to a brighter year ahead. We will strive to ensure that you feel appreciated by and connected to the wider RCSI family. So together with Quiva, Laura and Stuart, we look forward to a brighter year ahead. With the rollout of the vaccine, I hope we can warmly welcome you back to Dublin in August 2021, so that we can celebrate the gathering in person with you. In the meantime, as a token of our gratitude, we will be sharing a Christmas thank you with you. And we've made it especially for you, so please keep an eye out for it in your inbox in the coming days. For now, it's farewell, but it's not goodbye. And we're wishing you a festive season and a very happy new year. Slán go fóill. Bye.